Hello everyone. We are going to talk about atrial fibrillation today. Atrial fibrillation is virtually irregular heartbeat. Many people get this irregular heartbeat. Sometimes it's a feeling of sinking feeling, like heart is coming down, or in our language we say heart dil doobta hai. Yeah, the other words is the heart is skipping beat, and sometimes if it skips too much, then for a prolonged period of time, then we can call it a bizarre or irregular heart rhythm. In other words, we can call this as atrial fibrillation as well. And the way atrial fibrillation works, we are going to talk about this. As you know, this is the heart. We talked in the past as well. These are the upper chambers of the heart, which is left atrium and the right atrium. And you can see the activity which starts from the SA node coming down to the AV node. And so there is a lot of irregularity in the heart muscle itself, which leads to chaotic rhythm. So, in particular, in atrial fibrillation, for example, the heart rate can go up to 600 beats per minute. And the blessing is that imagine if all those heartbeats are coming down to the ventricle will beat around 600 beats per minute, and that's a disaster because the heart will be then shivering like this, and it's impossible to have any effective pumping, and that can lead to sudden death. But the blessing is that the Almighty, the way the heart is made, there is like a sponge here. So even if you have a heart rate of 600 beats per minute on the upper chamber, the lower chamber are not going to get 600 rate because a lot of those beats are actually going to be filtered there. So most of the time you get heart rate up to 150, 160, 170, and obviously this quicker the heart beats, the pumping is going to be ineffective because heart does not have enough time to fill. For that reason, atrial fibrillation, one of the main reasons that it doesn't look very good on patients' health is because they feel short of breath, and one third of the heart pumping or the cardiac output is actually affected because the atria cannot push blood from the left upper chamber, which is the left atrium, to the left ventricle, and that's one of the reasons why you feel so actually short of breath. So there is a lot of risk factors which can lead to atrial fibrillation. One of the most common is obviously age. Then you have a high blood pressure. Then you have a disease of the valves of the heart itself, and then there is a correlation. The more obese you are, the higher are the chances that you're going to get atrial fibrillation. It's a very simple mathematics. It really makes a lot of sense that a pump which is made for 2 stories and you build 4 or 5 stories on top of that, so that pump is ultimately going to fail. So this is what happens when you are very big or huge. Ultimately the heart is going to give way, and then obviously there is an incidence. So if you're obese you are, the higher the chances of atrial fibrillation, and the more active you are, the chances are that you will not get atrial fibrillation. And the curve actually tells us the older you are, the higher the chances of atrial fibrillation. Like if you pick, say, 100 people random uh, out of the street, and if they are more than 70 years old or more, the chances of them getting atrial fibrillation actually get higher, up to almost 20% in patients who are more than 80 years old. So this is something to think about. Then obviously there are other risk factors we talked about. If the lower chamber of the heart has high hypertrophy, that means the muscles are thickened, then certainly that will lead to higher chances of atrial fibrillation, as we talked about in the past as well. This is we have how to diagnose atrial fibrillation. For atrial fibrillation to be diagnosed, you need to have the ECG at that particular time when the event is happening. So if you have a 12-lead ECG, certainly you can look at that, and the chaotic rhythm or irregular heartbeat will be obvious. But in many people, atrial fibrillation is actually an event which sometimes comes for a few minutes and then disappears. And then it will come back again after a few months or few days or few years sometime. So nowadays we have a very good technology called ILR. ILR actually, I don't know whether the camera can show, but certainly this is a small piece of electronic, it's a metallic piece which is put it under the skin, and it's obvious on the chest x-ray itself. It's right there, and that can actually stay in the system up to 12 months or even more. For that, this can actually record every beat, and this can actually tells us, we can, from the surface itself, we can put a little magnet type of monitor which will get all the information or data. You can take that ILR out after a specified period of time, as long as you can get the diagnosis. It's not more than 2 inches uh, long and like half an inch wide, so, or even less than that. So this actually is extremely helpful way to diagnose the atrial fibrillation. And obviously people who have chronic atrial fibrillation, they can be diagnosed at any time on the EKG or ECG. So this is how you look at it. So there are a lot of risk factors, as I said: hypertension, diabetes, heart failure, valvular heart disease, smoking, and alcohol. People who drink alcohol obviously are going to get into trouble sooner or later. And then the options are, so you, there's another risk factor is the sleep apnea. So if your partner, your husband or wife, they snores a lot, and they stop breathing in the middle of the night, and they are big, most likely they have what we call sleep apnea. When you sleep, the tongue falls back into the throat, and you have this gurgling sound, and sometimes you stop breathing for a few seconds, and then the brain itself kind of jolts you and wakes you up. So this way you can be awake, and the normal the person can be awake and able to breathe and able to have a normal rhythm as well again. So atrial fibrillation is one of the risk factors. Obviously is the sleep apnea. So the chances are, the management will be, you lose weight, you stop smoking, control your diabetes effectively, control your blood pressure effectively, and be active, and this will hopefully improve the chances of you going into chronic atrial fibrillation. And then, so there are 3 things we need to take care of in atrial fibrillation. Number 1, we need to make sure the rate is controlled. If you have a chronic atrial fibrillation, that means you've been having atrial fibrillation for a long period of time, then certainly with certain medicine, including beta blocker, digoxin, and many other drugs, we can control the rate. Second is the rhythm control. We call atrial fibrillation ablation. We're going to come to that in a second. But then most important is stroke prevention. Imagine if the heart is beating, the upper chambers are beating at 600 beats per minute. The blood, there is no concrete contraction of the heart itself. You just have a quivering like this. In that case, the blood is going to be stagnated here, and especially in the what we call left atrial appendage, and it can clot, and later on it can transfer into the left ventricle and into the aorta, and the stroke can happen. And that's a very, very significant and a bad side effect of atrial fibrillation. So in terms of rate control, as I mentioned before, it's easy. What about atrial fibrillation ablation? Atrial fibrillation ablation, obviously, as you can see, if you can ablate the atrial fibrillation originates mostly from the pulmonic vein, which is part of the left atrium, the upper chamber. And we can look at that again. So the way this heart will show us that the way the pulmonary veins, which we are obvious from the back as well, the atrial fibrillation actually starts right from outside those openings. And then we can go from the right side of the heart, we can go through the septum, which is obviously here the septum, which separates the left atrium from the right atrium. So the catheter is like this, and it becomes like this, like a U shape or sometimes figure of 8. And you can position it right around the pulmonary veins opening, and then you can ablate with cryoablation. Ablation means you can burn those areas around the mouth of the pulmonary veins, and this will lead to, hopefully, success rate is around 60 to 70%. In some good hands it can be up to 80%. Sometimes recurrence does happen and you need a second procedure as well. And then once this is another close-up for the atrial fibrillation ablation, and once this is successful, many people can end up getting rid of some of those medications as well, and this is a great blessing. So in summary, the atrial fibrillation certainly is, once it happens, is a big nuisance and potentially a life-threatening, and a situation where you can have a major stroke or heart failure or many other situations. So hopefully this video was helpful. Please review it, look at it, and hope. And if there are any comments, let us know. Thank you.